Yeah, I think the comments around the table here are typical of what took place during the conversation in Burnaby. The facilitator at the end of the session, we'll all remember, asked people to sum up in 2 words what their opinion of the conversation was, and the general direction of it went exactly as is being stated here around the table by most people. I would just quote a couple of the comments: cynically hopeful, skeptical, now we need action, time well spent, in one case, exercise in futility, cautiously optimistic. And the facilitator made the point that that was typical of the conversations, the previous ones that had gone on before Burnaby. So she said it's typical that people are cynical coming into the conversation, and I think it's, that's got to be obvious, because in the brochure that was sent out by the government to all homeowners, or to all mailing addresses in BC, was asking people to take part in the conversation. And as is being pointed out, that program was a political document to start with, but the comments of the Premier are that what we are doing is not sustainable, and that was part of the whole platform that was put forward. So it was very orchestrated, although quite carefully orchestrated, that it is, we can't keep going the way we are, that it is over budget, and it's taken up 43% of the budget and things like that, which in fact is not true. And I think that part of the conversation was that most people were cynical or skeptical about it. But of those that I talked to there in the 6 sessions that I was involved in, I would say quite carefully and conservatively that 90% of the people were very firm about maintaining public Medicare. They did not want 2-tier Medicare, and they didn't want people to be able to move to the front of the line because they had money in their pocket.
What has your first-hand experience been so far with the conversation on health?
I guess first and foremost, recognizing that it's really natural for people to feel a skepticism, a mistrust of government, and so you see people enter the process with that in mind. Their guard is up and they're not sure what to expect, and I've been so pleased to see that type of attitude begin to flow away as people become more involved in the process, as they have a chance to make their views known. I don't know if they entirely trust the process yet, but I think we've made a good first step.
Do you see this initiative as the government not really seeing the need for citizens' participation, but as a way to sell privatization?
Well, in part it's been that. In part, it is the meetings themselves have gone on, and they ask leading questions, but people have participated. I think the message from the public, in spite of the manipulation of the process, has been pretty clear that they're opposed to privatization in general, and that's the message that has been sent to the government. Hopefully, it's one that will be heard. One of the reasons I've encouraged people to get involved is that this is they've clearly gone to this step of having a conversation because there was not public support for their agenda, and they are going to use this conversation as a way of supporting their agenda. And so I encourage the public to get involved and have their voice heard in this process, regardless of the problems with it, because the debate is too important. The public health care system is too important to be left to a government that can't be trusted on the question.
Do you feel that despite the process being framed, like you said, that our current system is not sustainable, that we're in a crisis, and or somewhat suggesting that there needs to be privatization or options or whatnot, do you feel that the process of the day went outside of that box because citizens engaged and were able to put forth an alternative to what the government seems to be promoting?
Yes, the whole conversation showed that people were very, very positive about public health. And I only met 2 people who wanted a little bit of private health care. Now, they were in favor of the public health care system, but they felt that there should be some opportunity for private delivery of some aspects of health care. So, all in all, what we're looking at is the citizens are saying, we want public health care, and we're prepared to pay for it. So when you talk about sustainability, you have to say, well, it's up to governments to collect the money that we have agreed to pay and pay for health care. So sustainability doesn't enter into it if the government is committed to doing what the people want. They can put some more taxes on. Because when we say we're going to pay for something, and that's what we want, we expect we're going to pay for it. So I don't see the sustainability entering into it.
I think that sustainability issue raised by the Premier and others is a bit of a Trojan horse here, in the sense that our provincial spending on health care, and in Canada for that matter, has been relatively stable over the last 15 years at about 7 cents on the dollar. I noticed in the first conversation on health that was broadcast on television, for at least part of it, the opening part, they had a little meter running in the background which rolled cents, dollars, and hundreds of dollars, thousands of dollars per minute, per second, per hour, per day, as to what the healthcare system was spending at the moment. However, what they didn't do was to take these figures and break them down on a per capita basis, which is a fair way to do it. And just to put that in perspective, per capita spending for healthcare in British Columbia now is less than 1/100th of a cent per second, about half a cent per minute, 34 cents per hour, $8.17 per day. That's for each person in the province. I think those figures are relatively sustainable, and they have been over the last few years, and they can continue to be in the future. I think if the government uses some common sense here and implements some measures from the management standpoint where they make more effective use of the health system, we in fact could save a lot of money.
I truly feel that the BC Liberal government manufactured the whole concept of sustainability of our health care. I think the issue was created and then managed. And I think that the conversation is one piece of that management. I also think that this was a way for the Gordon Campbell government to almost have a litmus test to see what the public tolerance was, right, for breaking down and dismantling further than what they've already done our public health care. And I think that what everybody here at this table was at Burnaby. And as Bill said, in Burnaby they told us that our response, throughout the day and at the end of the day, was a similar theme that they've heard throughout the province. And that is overwhelming support for our public health care system and an overwhelming pushback against the government's agenda of even telling us that it's not sustainable. And I don't know if they expected, perhaps they did to a degree because we were the 8th in a series of 16, but the pushback, articulate, thoughtful suggestions, and challenging the notion that they put out about sustainability. And to me, I'm just a layperson, but to tell me that something might not be sustainable implies to me that it's going to disappear, right? Like somehow it may not be around.